I'm going to, at this time, it's House 2214, Senate 1467, an act establishing a commission on quality patient outcomes and professional nursing practice, an act establishing a commission on quality patient outcomes and nursing staffing. I have a panel here for Christine Schroff and Silda Mello. Christine and Silda, are you here?
Yes, I'm here. I believe Silda is here also.
Okay, welcome.
Yes,
and before we go, if you've already given testimony on Teams, I'm going to ask you to log out, join us, and watch us on the legislature's live stream, so you can join us, but we will ask you to please log out, or sadly, we will log you out. But I'd rather you do it. So thank you. Welcome.
Thank you. Good afternoon, Representative Decker and members of the Joint Committee on Public Health. Thank you for the opportunity to testify in support of House Bill 2214, Senate Bill 1467, an act establishing a commission on quality patient outcomes and professional nursing practice. My name is Silda Mello, and I am the president of the American Nurses Association, Massachusetts, the largest voluntary professional nursing organization in Massachusetts. I am a registered nurse at a large Boston area hospital and a resident of Lynn. Our members at ANA Mass, many of whom care for hospitalized patients, continue to struggle daily to adequately provide the nursing care they know their patients need because of time, resources, and environmental constraints. As you know, this has been a problem for a number of years, most recently made public in the divisive 2018 ballot question. And I know we've talked a lot about sort of nurse staffing today. So the 2018 ballot question, which offered one solution to adequate nurse staffing. Although over 70% of voters in the Commonwealth voted against the ballot initiative, the issue of nurse staffing remains and has been exacerbated by the effects of the COVID-19 pandemic. Stakeholders remain divided on how to approach this problem, but we fear that the situation will only get worse as our population continues to age and the demand for adequate nursing care increases. We cannot afford a delay in finding a path forward to address the issue of nurse staffing. Our healthcare system is complicated with stressors identified by all hospital stakeholders who desire patients in their hospital to receive good nursing care, nurses, physicians, administrators, and especially the patients themselves. Each party may not fully understand why their approach to the delivery of safe patient care is not the primary concern, given the unique stressors each stakeholder faces. This has caused a divisive atmosphere in many hospitals, which exacerbates the problem rather than developing workable solutions. This bill offers an opportunity for the major stakeholders to work together in addressing the challenges of balancing the resources needed to provide quality care and the support of other critical hospital operations. A shared understanding of the issues and stressors facing practicing nurses and administrators can lead to a better collective understanding of all factors and development of workable approaches with the goal of quality patient care delivery. There is much evidence available from others who have approached the same problem in states around the country. It's time that nurses and other stakeholders have the opportunity to examine the information available to develop a path forward for the citizens of Massachusetts. Thank you for the opportunity to speak to you about this important bill. ANA Mass will also submit written testimony for your review, and please reach out if you have any questions.
Thank you very much. Okay.
And Christine.
Yep. Thank you, Christine. I believe Silda is not here.
Oh, no, this was Silda.
Oh, you're Silda. So is Christine Schroff here?
Yes, I am. Can you hear me?
Yes, I can hear you. Welcome.
Great. Thank you. Good afternoon, Representative Decker and members of the Joint Committee on Public Health. Thank you for allowing me to also testify in support of HB 2214 and Senate Bill 1467. My name is Christine Schroff, and I'm the co-chair of the Health Policy Committee of ANA Massachusetts. I've been a nurse for over 50 years and spent most of my clinical career in the specialty of dialysis. But after completing my last nursing degree, I entered academia and was an associate professor in nursing at Elms College in Chicopee for several years. These days, I'm an adjunct faculty member at Elms teaching health policy and advocacy to graduates, master's, and doctoral nursing students. I'd like to offer a few perspectives in addition to Silda's testimony. The ongoing and complex issue of how best to match patient care needs with the nurses needed to care for them is best left to those who will live with the recommended approaches. That includes nurses, hospital executives, and patients, as well as those in state positions who can make the proposed solutions happen. This is why we have created a collaborative commission of specific organizations and state office holders in this proposed bill. There's no doubt that this process may be difficult and messy, but everybody can agree on the desired outcome: safe and effective nursing care for hospitalized patients, accompanied by nurse satisfaction with the care provided and ongoing staff retention. This last factor is especially important since we are also experiencing a critical nursing shortage exacerbated by the pandemic. Many of our most experienced nurses left hospital practice because of health risks, and we need to replace them with those who can continue to provide expert care as well as mentor new staff. As summarized by the Health Policy Commission, many institutions are experiencing a revolving door of nurses as they become disillusioned with patient care they can't provide, in addition to their general exhaustion. We found in our research on this topic that proposed approaches to nurse staffing are many, both in recent state legislation and also other hospital systems. The commission recommended in this bill may find that some of these could work in Massachusetts hospitals. Our hospitals vary both in size, services, and the types and amount of care that patients require, so different solutions may be needed in each hospital. As detailed in our written legislation, staffing approaches such as color-coded teams based on RN experience or in-house voluntary nurse float teams could help to accommodate the changes that occur in patient census and acuity. We can't afford to wait to work on this problem. As a member of the aging baby boom generation, I know that this significantly high blip in our population will only cause patient care needs to increase.
Thank you. At this time, I'd ask if you would like to submit any of your testimony, please do. Thank you for your time.